For the past few years, we have done quite a bit of work in this area, and what we have seen actually in people with fairly severe mental illness, yoga can be quite beneficial as an add-on to the medicines that they're already taking, and in a few cases, it can be a treatment by itself. We have had people who have not wanted to take medicine and were looking for alternate methods of treatment, and even in those people we have had fairly good success with yoga as a sole treatment option. The percentage of such patients though is on the lower side. Most people do yoga as an add-on to their existing treatment strategies, which could include medication or psychotherapy and other treatments. So yoga has produced significant benefits. To name a few disorders: depression, schizophrenia, anxiety, and attention deficit hyperactivity disorder would be a few. There's quite a bit of evidence in terms of publications as well as meta-analytic reviews, which basically give a better idea because they take a lot of data and combine it in a meaningful form. Individual studies are quite difficult because single studies may not give the evidence required in terms of for people who want to know whether it works and how well it works. So in the last 10 years maybe there's quite a bit of evidence both from India and abroad for yoga as a complementary treatment in disorders like schizophrenia and depression. Much of the work in India has been done in our own institute, NIMHANS, where we have actually published more than maybe 25 research papers in various national and international journals to show that yoga works quite well as a complementary treatment in major mental disorders. Most of it is available on the internet, free. I would refer to a recent supplement of the Indian Journal of Psychiatry, July to September 2013, which is available on the net free. It gives quite a good information about how yoga can be a complementary therapy for multiple mental disorders. It's a very interesting question, and the question which I get asked in many forums. There are two issues we need to look at here. One, of course, is that if you ask many yoga teachers or people in yoga schools, they don't look at yoga as a therapy in that sense. They insist that yoga is a lifestyle which has to be lived, not looking at any specific benefits in terms of illness, but rather looking at a way of reaching the goal set by the individual, which could be salvation, which could be mental health, which could be physical health. So yoga as a therapy is a fairly recent construct, maybe in the last 2 or 3 decades. And before that, yoga was looked at a purely lifestyle kind of issue. That is the one major issue from the yoga point of view. The other, of course, is the difficulties inherent in looking at yoga as a therapy, because most journals now ask for what is called as a randomized controlled trial, which is a methodology which is suitable, very suitable for testing medication, where one person with the illness is given target medicine and the other person is given a very similar looking pill which doesn't have the active ingredient. Now yoga, as you all know, cannot really be done like that, because the person who is doing yoga cannot be blinded to the fact that he is actually doing yoga. So you cannot say that this person doesn't know he is doing yoga, whereas in medication that's very easy to do. That is one big problem that we are trying to overcome by using various methods to convince the scientific community that yoga is a effective therapy. So these two issues I think are why yoga has not been really looked at as a therapy as it should be. Yoga as a treatment, like I said, is still being looked at as a preliminary kind of evidence. Now, whether it works better early or late is something that we have to look into the genesis of psychiatric disorders itself. Now, we very well know that in most psychiatric disorders, the earlier the treatment is started, the better the prognosis or the outcome for the individual. This is fairly well established evidence in most psychiatric disorders, including schizophrenia, depression, OCD, most other disorders. Now, if yoga works, it should theoretically work better in the early stages. Now, this hasn't been well proven yet, but going by the logic, it should. If you look at the other way, how does yoga work? That's a very important and interesting question that scientists around the world are now trying to answer. We believe that it basically helps the innate repair mechanisms of the human brain to do its job more efficiently. In other words, it helps the body repair itself. Here I am talking specifically of the brain. So even seen in this logic, the earlier it is started in the course of the illness, the more effective it should be.